So it looks pretty ramshackle, but it's actually probably the most sophisticated healthcare facility in Haiti, and parts of it are the most sophisticated healthcare facility that Haiti's had in its history.
And pretty much the orphans are not cared for, so they don't really get fed throughout the day. So my job was, I wake up in the morning, I go see if they're up, and if they're up, I feed them breakfast. And after I feed them breakfast, I take them to pick out their clothes, I take a shower, make sure they're changed. When it's lunchtime, whatever we were fed, also I'll make sure to get a portion for them to make sure that they are also fed. Because sometimes I watch that, like I'll give them a sandwich, somebody will come and just snatch it from them, and I'll have to go back and say, you give them back that sandwich. So pretty much you were there to fight for them.
This is one of the babies that was in the PICU, and I'm putting in a Foley catheter. One of the nurses was like, do you want to learn how to do that? And I said, sure. And the baby was sedated, and so it wasn't that difficult. It took a while, but the baby wasn't in pain or squirming around, so that was an interesting experience.
Can you go back to that baby?
Yeah.
I had actually just, the last night before this was taken, I had scrubbed in on surgery with this baby, and it came in with a severe distended abdomen, and it turned out the baby had both congenital malrotation and an endoception, is that right? Where the valve's actually pulled in on itself and basically like plugs itself. So about 2/3 of the large valve was basically dead or necrosed, so we had to take it all out. And we would have done more, but the OR doesn't have any method of temperature regulation, and the AC was blowing, and they kept it very cool, which was nice normally, but when you have a little baby completely open and the intestines all pulled out, you really can't leave it in such a cold environment with no warming measures. So eventually we had to close up the surgery early just because the baby's temperature had started dropping. So we had fixed a little bit of the problem, but it still had more work to do.
But that baby probably would have died.
And then this is the NICU PICU, and right behind this kind of metallic curtain, there's these two cousins, these girls aged 11 and 14, that came in on our first night with third-degree burns on like 80% of their body, and almost immediately one of them died. And we were in charge of disposing, like putting her body in a body bag and all that kind of stuff. It was really, really sad because her whole family, that's her family right there, they're all right there. But her sister kind of stabilized a little bit, so I started working on the paperwork to get her to the U.S. Because Shriners Hospital in Boston offered to pay for all the expenses and take care of her treatment and all that kind of stuff, which was amazing because it's insanely expensive to do that. But the question was whether the paperwork would get through in time before she died, because they kept giving her like 12 hours to live and then like another 12 hours to live, and it was always kind of down to the last minute. But
I want to say something about that picture over here.
Yeah.
Just another thing about those metallic sheets, that's another facet of not having temperature regulation. Because the burn patients needed to be kept at a higher temperature since they couldn't self-regulate their temperature, they actually built a makeshift incubator out of just metallic sheets surrounding one big high-power lamp. And it actually keep the inside of that like over 100 degrees as compared to the rest of the air-conditioned NICU PICU. So that was just for the burn patients to keep them warm.
So this was a case that I was working on all week, and it came down to the last second. And we were talking to the minister himself of the Interior and the Minister of Health, trying to get exemptions for this girl. And finally, the morning that we left, actually, she finally got her clearance to go to the U.S. And then that was Saturday morning, and then Sunday morning, we had this air ambulance come, and this is her being loaded onto it to go to Boston. So, and she absolutely would have died if that hadn't happened. So it was a pretty huge thing for her.
And the most recent update from the physician's assistant who was in charge of taking care of her is that her first night at Shriners went really well, and they were impressed with the type of care that she had received in Haiti. And that's just kind of a testimony to what the field hospital was capable of.
This is a picture of me kangarooing a baby. So preemies, it's been shown thrive with skin-to-skin contact or skin-to-hair contact in my case. Anyhow, so we literally had maybe like 8 preemies at a time, and so every day they'd be taken out and just put on your chest and just like strapped in so that they get that skin-to-skin contact. Because a lot of studies have shown that actually like it has drastic improvement rates, like over 60% improvement rate for preemies thriving. So all the nurses would do it, and then one day they got me to do it. There I am. And we actually ended up singing Frere Jacques to all of them as well, because that apparently helps, but that's another story. This is what we would do when we had 2 isolettes for 3 preemies each. And so those obviously got full. So we had built makeshift ones out of suitcases, just to keep them warmer and just enable us to monitor over them